Thank you, Marilyn, and good evening, everybody. And as you heard, I am not a mental health practitioner, so my talk tonight is going to be from a managerial perspective. Monica, we need to get the slide set up, please. So while we're waiting for the slides to come up, Monica, you've got a video icon. There we go. Okay, so we're going to really look at it from a managed perspective, and we're going to look at how do we reduce the risk factors that's driving burnout, especially in a work environment. Next slide, please. So let's do a quick little poll. How are you feeling today? If you're tired, type in A. If you are worried, B. You can see where it goes. I just want to see that in the chat function. So and all I'm doing now is I'm just asking you've done a quick little survey about how you're feeling in the moment. And what you're going to find, we do these snap surveys in our organization, is you're going to find that there's going to be a lot of people who've said that they are anxious, or they're feeling depressed, or they're feeling angry. So we know there's a lot of negative. Monica, there's a video of me playing in the bottom. I think you used the wrong slide set. You used the recording in case there's, yeah.
Okay, so we are sharing now the actual presentation, Gustav.
Yeah, just share the slide set. This was the backup one in case there's load shedding or something that prevents us from. Right, let's kick off. So next slide, please. There you've got the little question. So use the chat function and just type in, how are you feeling at the moment? Are you tired? Are you worried? Are you depressed? Are you angry, happy, motivated, or excited? And as I said earlier, we run these surveys in our own organization, and we could, during the pandemic, we could see how people started moving from the positive emotions to the negative emotions. Next slide, please. Now, if you're tired and worried or depressed, next slide, please, Monica. Thank you. Go and do a survey if you're worried that you are at risk of burning out, because what we've really found is that if people are tired, there is a high risk of burnout. And the Oldenburg burnout inventory, and you can see the link there at the bottom of your screen, if the slides can go forward and not backwards. Thank you. Okay, there was a link there, but you can just Google Oldenburg burnout survey. It allows you to test your own burnout risk. But what we do know is that we live in a country where we've got huge mental health problems. So in the 2021 World Mental Health Report, they rated 34 countries where we were right at the bottom, and we were right at the top for being distressed and struggling. Next slide, please. And this is not a surprise, right? We knew that there was a lot of mental health problems in the world even before coronavirus appeared on the scene. WHO in 2019 estimated that about 1 billion people were living with a mental health disorder. And we know it's just become worse. So we know that common mental health issues have gone up between 3 and 7 times since the corona pandemic has started. And we as a country are very poorly geared towards dealing with it. We spend a very small part of our government health budget on mental health, and most of that goes to psychiatric hospitals. So in essence, it means that there's very little community level mental health care, and current estimates are that 90% of people who need mental health care do not get it. So people with anxiety and depression just have to live with it. Next slide, please. Now, ignoring a problem, you all know, doesn't make it go away, and we can't afford as a country to ignore this, right? We're dealing with a massive mental health pandemic, and we also know that the impact of that is not just on people's well-being, but it's also got to do, there's a huge economic price we pay for it. So the estimates are that the country loses about up to 200 billion rands a year. Now, just to give you put that in context, 2 years, our loss of productivity is equivalent to Eskom's debt. And Professor Melvin Freeman, who is one of our policy advisors, had a really nice point. And he said, we have a moral and economic imperative to improve mental health care. Next slide, please. So the question really is, what can you do? All right. And all of you are interacting with other people. So if it's in a work environment, it's your colleagues, it's the team that you're leading, but it's really about understanding what are the risk factors that drive burnout, and how does it apply to yourself, and what can you do for yourself, and what can you do for your colleagues, and what can you do for your friends and your family. Next slide, please. So burnout is a real medical condition. It's in the World Health Organization's international classification of diseases, and what there's really sort of 6 big things that drive burnout. One is your workload. The second is whether you've got control. Then it's the reward system. It's about how supportive the community is that you're in. It's all about fairness, and it's all about values. And all of these factors are structural issues. So in other words, self-help solutions is not going to eliminate burnout in a work environment if you don't focus on dealing with the underlying structural workplace issues. Next slide, please. And we're going to look at those as we go forward. But what we also know is that not only has had the pandemic a huge impact on us, but also our remote work and our return to work policies as the world starts normalizing is also adding enormously to the amount of stress and burnout that employees are facing. Next slide, please. Now, we know that there's lots of different views about coming back to the office and whether it should be on a full-time basis or a part-time basis, in other words, a hybrid model, or whether you should come back at all. But what's interesting is to see that there is a big disconnect between executives and employees. So lots of executives are very keen that everybody comes back to the office, and most employees think it's a really bad idea. And what this has triggered is resignation, and it's causing stress and burnout. So if you force people to come back into an office environment, then you know you're adding to their stress. Next slide, please. Now, why are the bosses so keen to have people back at the office? So the common reasons that they raise is there's concern about high turnover, about people who join during remote work models. And to a certain extent, that would be true if you didn't have a proper induction process. There's worries about deteriorating organizational culture. The only problem is there's no evidence to support that people working remotely has a negative impact on organizational culture. The same around concerns about productivity. Again, no evidence. Actually, the evidence shows the opposite. Lots of knowledge workers who work remotely has shown increased productivity. And then there's a concern that if we don't put people together in the office, we're going to lose that ability to spontaneously generate new ideas. And again, there's no evidence to support it. Next slide, please. Right. There is concerns about staff morale, and to a certain extent, some of this is true because there are some people who really need to interact. Actually, all of us need to interact, and we need to socialize. It's a fundamental human need. So getting people to interact is important. There's concerns about overhead costs, which is true. You're keeping big offices open with very few people in it. And then perhaps more, not less valid reasons. One is just older executives are used to managing by walking around, and therefore they can't keep their finger on the pulse. And then ego is a big factor, right? If you are the glorious leader, what's the point of having the corner office and the executive dining room and things like that if nobody's there to see you? And that really would be the worst reason, but it is a real reason why sometimes executives want people back in the office. Next slide, please. Now, on the other side are the employees, and the employees say, listen, we've been much more productive working remotely, and there's lots of research that supports that, but then also there's the cost of commuting. As you all know, it's gone through the roof, and especially if people are coming back to the office in the middle of the year or towards the end of the year, and they've got kids that need after-school activities, that it's very difficult to get them in those programs at this time of the year. Next slide, please. So the other thing, so there's a big issue about people coming to the office, but there's also quite a number of factors around people working remotely. And you've all heard of the term Zoom fatigue. So what happened is, as we all went online, we after a while realized that we're not comfortable seeing ourselves on the camera the whole time. And then instinctively, we started switching off the camera, but then we did a really bad thing. We started multitasking. You check your emails, you quickly check your WhatsApp while you're supposed to be in a meeting. And as we'll talk a bit later, multitasking is really a big stressor. Next slide, please. The other thing is, what became very easy in Zoom and Teams and these online platforms is to schedule back-to-back meetings. So you finish one meeting and a minute later you're another meeting. And that is detrimental to our mental health, because we are not programmed to not have a break between activities. We want to have a clear beginning and an end to a task. And in the real world, in an office environment, if you had a meeting in your office, you'd probably walk the person out of your office and another person would come in. But that has disappeared. We teleport between these meetings. We have no time down, and that creates stress, and that leads to burnout. Next slide, please. So I touched on multitasking earlier, but the bottom line is it's just bad for us, right? So if you're going to be in a virtual meeting, switch the camera on and focus on the meeting instead of not. You might as well then rather not be there. And one of the worst practices I've run into is people who run concurrent multiple virtual meetings. So they're in one meeting listening to the conversation while watching another meeting with the scrolling function where it translates what's happening there. So that really is a bad thing. And the worst part about it is I've run into people who said, I have no choice. My bosses tell me that's a type of multitasking. It's just bloody stupid. Next slide, please. So let's look at these big risk factors and see what can we do about it, and how do we create an environment in the office that's conducive to good mental well-being. Next slide, please. So the first one that we're going to look at is our workload. So we all need to have enough work to keep us busy, right? Sitting in an office and having nothing to do is not good for you either. But you must be able to do that job in the hours that you are supposed to work. And you need to be able to have some free time for rest and recovery and personal development. And if you're chronically overloaded, those opportunities to restore balance to your life disappears, and that leads to stress and burnout. Next slide. And the reality is, this is an interesting WHO study, but it's shown basically that working long hours consistently kills you. So they looked at causes of death, and what they found is that especially in middle-aged men, there is an inclination, if they've worked long hours earlier in their life, they drop down dead, often decades later. Next slide, please. The other thing we've also seen is, especially as people went into this emergency response, is something that's called toxic productivity. So it's especially the dedicated people who are, those people we talk about and say, well, they will die trying. The problem is they do die from trying. The other thing we've now seen with, as people are coming back to the office, is especially where employers are disconnected from what the employees want, is we've seen a big resignation. So there's lots of people who've changed their jobs. In South Africa, we've also seen a massive outflow of skilled people out of the country. And that has triggered overloading. The people are willing, but there's also a bunch of people that they refer to as the quiet resignation. So these are the people who reluctantly come back to the office and then do the absolute minimum. Next slide, please. Right. And the fact that we tend in South Africa not to focus that much on upskilling people to cope with this rapid changing environment and giving people mental health skills, all of that is creating a stressful environment. Next slide, please. So our next risk factor is around the community. So we all need a supportive community, whether it's work or home, and you need to trust people in that community, and you need to be able to boost morale, because that's what happens if you're in a positive working community. The opposite of that is a toxic work environment that some of you've probably experienced. Next slide, please. Right, so what is really important is that we manage our risk factors, right? So we need to have good communication, because that's what helps build a community. And you've got to have psychosocial support for each other. So there's got to be opportunities for people to talk about their personal situation, their personal problems. Next slide, please. And we really need to socialize. That is the bottom line. So you've got to build time in your work day, especially if we're now only working on a hybrid model, which is the model that the vast majority of companies have embraced. Very few are going back to a full-time work environment. We also, if we spend less time at the office, we tend to fill our diary with work-related things, and that's a mistake. You need to have some time to socialize, you need to have some time to chat, and employers need to think about getting social events going. Next slide, please. Even what we've also seen is, as people adopt hybrid working models, not everybody is at the office at the same time. So if there are people that you previously connected with who's now working on days when you don't come to the office, pop in on one of those days when they are at the office, that you can just go interact with them, or set up some virtual meetings, but keep the camera on. Our brain is okay if we socialize with our friends, right? And remember, your community is much larger than just your office environment. So if part of your life has been the conference circuit, get back on that conference circuit. We had the first of our big national TB conferences a week ago in Durban, and it was incredible just to reconnect with people that I haven't interacted with in a physical sense in the last 2-3 years. Next slide, please. The other big risk factor is if people feel they don't have control. So if they lack autonomy, so in other words, if they're being forced to do stuff, if they don't have adequate resources, and if they've got limited say on things that affect them professionally. So these are all factors we can control as managers or as members of a team. Next slide, please. So in order to give people control, one of the big things to make sure that you start ensuring is that people understand they get paid to work 40 hours a week. They don't get paid to work 24 hours, 7 days a week. You cannot expect it from them, but also make sure that they're not falling into that pattern. Because a lot of people went into an emergency response during the pandemic. And even in this post-pandemic phase, because the economy is dodgy, there's a lot of people who are putting in incredibly long hours. You've got to force people to come down. In France, they take it so seriously that they've now passed laws that in essence makes it illegal for an employer to send emails to people after hours. So don't contact people after hours unless it's a genuine emergency. Next slide, please. We've talked about talking to your staff and understanding what their needs is, but this is incredibly important. Talk to them, find out what they need to return to the work, make sure they've got the right resources. A lot of the complaints we hear about people is coming back to open plan offices, right? Because suddenly there's lots of distractions and noise and they don't have a door they can close. So talk to people, and if you can fix it, but don't ignore it, because then it would be better if you hadn't asked people. Next slide, please. Right, for yourself, when you're not at the office, it's important that you close the door of your office at home at the end of the day. So have a designated work area if you've got that luxury. But if you're using a communal area, at a certain time of the day, you say, it's 5 o'clock, I stop working, I pack my stuff up, and I close the door and I work away from that. Our brain really needs that switch to say, work has stopped, and now my personal life is starting. Next slide, please. And as I said earlier, stop multitasking, right? And that means also digital multitasking. Next slide, please. Something which is a really important thing is if you're working at home, consider building in a fake commute. So what we've also learned is that the process of driving to work or commuting to work and coming back is actually a really good period for reflection and planning. And if you're working from home, you don't have that time that goes to a commute. So some people actually get in their car, drive around the block, drive back to their house, then get out of the car and go to work. And at the end of the day, they do the same thing. Next slide, please. Your reward system, that's the other area that everybody needs rewards and everybody needs acknowledgement, and they especially need it now. So think about how do you acknowledge and reward people in your work environment. Next slide, please. And what is really important with recognition is it's got to be legitimate. So in other words, it can't be a generic 13th check that everybody gets, or this concept that we're all winners. It's got to be personalized. And it doesn't have to be terribly formal. Send people an email, do a shout out to them, write something about them in the newsletter. But all of that builds people's morale. It gives them a sense of community, and it gives them the recognition they need. And that creates a positive mindset and helps deals with all the stress and the hard work they've put in. People want to be seen to be doing that. Next slide, please. The other thing is make sure you're fair, right? So the questions you really have to ask yourself is who's getting away with murder? Who are those people who never hit their deadlines? Who are the people who are talkers rather than doers? And who are your unsung heroes? Next slide, please. So make sure that you acknowledge the people and recognize the people who are doing good work, but that you also make sure that you address the people who are getting away with murder. Start a list to understand who's pulling their weight and who's not. I can assure you, if you don't have a list, the rest of your colleagues have a list. They've got a very clear opinion about who's doing their work and who's not. And being in a leadership or a management position is about ensuring fairness. But the other thing we've got to watch out now that we go into these hybrid working models is a thing called proximity bias. So the way our subconscious work, the more we see specific people, the more we're inclined to see them in a positive light. So you've got to counter that. Just seeing somebody doesn't mean they're doing their work, and it doesn't mean they're contributing. You've got to have objective measures that measure productivity. Next slide, please. And the last one we want to look at is values, right? So we know if the organizational leadership don't live the values of the organization, it really creates a lot of stress. And we've seen it especially during this lockdown period, the amount of distress it's caused, where we've seen high levels of corruption and a lack of values and leadership among senior people, and it really affects the whole mood of the country. Next slide, please. And this is really important. The State of Moral Leadership report in 2021 said, in essence, that moral leadership is in high demand but short supply. But what we also know that managers who show that, who embody the values, who are moral leaders, have much better performance, much better interaction with their colleagues. And the bottom line is you cannot afford to turn a blind eye to values infringements, especially not amongst your leadership cadres. Next slide. So just in conclusion, next slide, please. So addressing stress and burnout in the workshop, in the workplace is incredibly important. And don't wait for organizations to put formal programs in place. You've seen what we've discussed. It's straightforward. It's just about being cognitive. What are these risk factors and taking steps to address them? But you can't afford to ignore it, because the next step after burnout is post-traumatic stress disorder. And what we know that it's very difficult for people to recover from PTSD. And even if they recover, they seldom go back to the environment that triggered that PTSD. So you might find that your top performing people, if they burn out, if they develop PTSD, they might recover, but they ain't going to come back to work in the environment that started this. Next slide, please. If you personally, if anything I said here today said, gee, I'm worried about myself, there is lots of online screening tools. You can go and check yourself whether you are at risk of burnout. You can check yourself whether you're depressed. But whatever you find on those screening tools, don't ignore it, right? One of the things we've learned is that tired is not just the indication that people are burnt out. It's often a code word for depression, because we are a highly self-stigmatizing society, and Mzee, who's talking after me, is going to talk about that aspect. We are not willing to acknowledge to ourselves that we're depressed, and it really is important that you're honest with yourself and that you understand it's okay not to be okay. We are living in very unsettling times, and 1 out of every 5 of us on this webinar tonight will need some form of mental health support this year. So if you feel you're at risk, go and talk to a professional person. Next slide, please. So thank you very much for giving me some of your precious time, especially after hours. If you want to talk to me in person, give me an email. If you want to know more of what we do at the foundation, please go and visit our website. Thank you very much, and back to you, Marulene.
Thank you very much, Gustaaf. So we're just going to have a quick short question and answer session. So our first question comes from Astrid, that's asking, does burnout affect memory? Over to you, Gustaaf.
Probably yes. Remember, I warned you, not a psychiatrist, not a psychologist, but certainly the more you multitask, the more you have too much on the plate, the more you're inclined to forget things. So, I mean, most of us have learned to keep notes, especially because we're moving at a high time. So I think, yes, it can affect your memory.
The next question is, how do we deal with toxic environment that affects our emotions? Over to you.
If you're in a position to address it, identify what's creating a toxic working environment, speak to the people who can change that environment, but otherwise leave that environment, right? It's just not worth sacrificing your mental health for a job. It really isn't.
The next question is, seeing that many of us, not most people, are not coping mentally with returning to the office environment. The number of panic attacks experienced has increased. What kind of mental exercises would you advise that people engage with?
Right, so Google will set you free, right? So everything from, there's a huge array of self-help and self-care options. So everything from meditation to breathing exercises to yoga to there's a lot of good common advice out there, and they work. They really work. And as far as I know, in the next month or two, there's going to be a South African cognitive behavior therapy app that's being launched, where you don't, in essence, you do cognitive behavior therapy using an app. You don't have to see a psychologist. It's going to be very affordable. So keep your eye open for those type of options.
Next question, Gustaaf, is where can we get tools to assess ourselves?
Okay, on the Mzwamadoda website. So it's Masiviwe, so mzwamadoda.co.za. There are screening tools on the website, and it also is we're also building a directory there that can show you where can you find somebody in your geographical proximity that you could go to for help. It also links you to the call centers. A phenomenal group we work with is the South African Depression and Anxiety Group. They've got call centers. Use them. They can point you in the right direction.
Next question, Gustaaf, is does burnout affect children?
Oh, yes, it does. Right. So we have, our kids are taking a huge amount of strain. So one of the scary things I discovered in the last sort of 6 months, I was talking to people who are working with the school health programs. Amongst our primary school children, 1 out of every 5 have had suicide thoughts during the last year. And in the high school environment, it's 1 out of every 4. So children are very prone to mental health, especially stress, especially anxiety, depression, and there's, again, they are often less capable to cope, and they also live in this social media environment, which can be extremely toxic. So again, if you're worried about your children, contact one of these support organizations like SADAG.
The next question is, how is burnout treated medically? Is it with antidepressants?
No. So you shouldn't be on antidepressants if you are not depressed, right? So burnout really is managing these risk factors that we talked to. So it's all about time management, about building those barriers, creating the right environment, etc. That managing burnout is a self-help process. If you start going over into post-traumatic stress disorder, that's when you need to engage professionals as well.
Gustaaf, the next question has 2 components to it. The first one is, would you recommend the involvement of a clinical psychologist in the workplace? And the second one is, what kind of interventions would they offer?
So for me, I think, again, it's the stigma and self-stigma situation. I think we do not use the professionals as effective as we can. I think there's huge value about bringing a clinical psychologist into a workplace. And what they often do is firstly, there's somebody who can talk to you, because that's what's really important, is that people have a sympathetic person with a professional background who can listen to their fears and their concerns, etc. Often a clinical psychologist in a work environment can have got access to senior management, so they can influence the environment. And the interventions can be anything from one-on-one therapy to pointing you to an app that you can use, to group therapy. It all depends what work you're doing, right? So if you, for example, a frontline worker, like a healthcare worker who's been in this pandemic, there is a huge need. You cannot believe what the stress and strain has been on the people who've been in the front lines of this pandemic. So absolutely great idea.
Thank you very much.
Most employed people also have access to employee assistance programs. So there's normally a call center you can call. So again, it's there, it's free, use it.
will be taking you through managing self-stigma in mental health. And my presentation outline is as follows. I will give you an introduction into the stigma and the definition of self-stigma, the model that is used for staging self-stigma, and then I will take you through the harmful effects of self-stigma and how do you then challenge the self-stigma, and the 5 steps that you can follow to define mental illness and stigma, and as well as how to cope with self-stigma. Then I will give you a summary and some take-home message. I want to apologize. I have a problem with my video, so you will not be seeing my face. Fortunately, Marilyn has got me there in her program. Sorry about that. In introducing my topic, I will share that one way to promote destigmatization and counter the shame of mental illness is to come out, so that you let other people know about your psychiatric history. And unfortunately, it so happens that many people deal with self-stigma by staying in the closet, and they shelter their shame by not letting other people know about their mental illness. But then, what is self-stigma? Self-stigma refers to the negative attitudes that people have internalized, like which include internalized shame, and where you always find that it will happen with people that will have mental illness and they are feeling some shame about their own condition. Some forms of self-stigma can be quite life-threatening, unfortunately, and one of the most common examples is where one feels like he's a burden, or that you are, or your family would be better off without you, which could lead to suicidal ideation and withdrawal or isolation from other people. The Mayo Clinic, for instance, describes stigma as when someone views the other person with mental illness in a negative way because they have a distinguishing characteristic or a personal trait that is thought to be or actually is a disadvantage. This is a negative stereotype, of course. Unfortunately, these negative attitudes and beliefs towards people who have mental illness or health conditions are quite common in our societies. So what is the model that you use for staging self-stigma? What happens is that when one gets mentally ill, they start becoming aware of what the public is saying about mental illness, like that. We call that the awareness stage, where you saying the public views people with mental illness as weak people. And then you move on to agreeing with this concept or perception and say to yourself, oh, this is right. People with mental illness are in fact weak. From there, you move on to applying this notion to yourself, where you're now saying that I am mentally ill, so I must be weak. After applying it to yourself, you move on to the harm stage, where you are now telling yourself that you are not worthy or able because you are weak. And once you reach that stage, the next thing that will happen is that you will reach what we call the why try effect, where you are saying to yourself, why should I try to pursue a job because I'm not worthy? Or why can I should not live on my own because I'm not an able person to live on my own. To further explain the why try effect, I will say that it is a consequence where you self-stigmatize, and it interferes now with your life goals, and then it functions as a barrier towards you achieving what your life goals are. However, if you have self-esteem and self-efficacy, you are able to reduce the harmful effects that are the result of self-stigma. And of course, the opposite will be that if you have a diminished self-esteem, then you are going to have that sense of being worthless, and then you will actually withdraw from opportunities at being independent, whereby you will be able to even go and seek a job or obtain a competitive job because you believe that you are not worth that job. And then what are the harmful effects of self-stigma? For starters, one becomes reluctant to seek help, as Gustaaf shared earlier on. People are not so willing to go forward and seek help or treatment. they lack understanding. I mean, there's a lack of understanding of who you are, I mean, or your problem by your family, by your friends, by your co-workers and other important people. And unfortunately, you get fewer opportunities for work or school or to socialize with other people. And you may even have trouble finding housing, you know, because of the social norms. And people who are mentally ill can be exposed to bullying, physical violence, and or harassment sometimes. And the unfortunate part of it is that you find that some insurance companies will not even have adequate cover for the treatment of mental illness. And now, this now leads to poor self-belief in a person. You know, where somebody says, I will never succeed at a certain challenge, or that I cannot improve this situation. But then how do you then challenge this self-stigma? The most important thing is to empower yourself. Empowerment is an antidote for self-stigma. It is an effective way for reducing self-stigmatization, and by encouraging people who are mentally ill to believe that they can achieve their life goals and circumvent further negative consequences, which are a result of self-stigmatization, we will have done a lot as they are important others in supporting and assisting them to deal with or challenge self-stigma. In a sense, empowerment is the flip side of stigma, I would say. And then also power, control, activism, and righteousness, indignation, and optimism are very much associated with a self of high self-esteem. So it means that if you are in that level in your life, you have got better quality of life and increased social support, which also now increases your levels of satisfaction with yourself. And then it also make you understand the need for mutual help programs, and then you become a player in the social arena. The second challenge, manner of challenging stigma is disclosure. We have a problem in that many people who are mentally ill, who have self-stigma, they kind of stay in a closet. They don't want to go out there and be open about their challenge. Of which one way to manage the stigma is to counter the shame by coming out and letting other people know about your psychiatric history, as I said earlier on, and of which research has already shown that when you open up about your mental illness, there is a decrease in the negative effects on self-stigmatization and on your quality of life. Therefore, this would encourage one to move towards achieving their life goals. When one is open about their condition, worry and concern over the secrecy of the condition is reduced, and therefore this leads to openness and it promotes a sense of power and control over one's life. This openness can also bring about discrimination, unfortunately, by members of the public, and could lead to some relapse, which now would be more stressful for the person, and in some cases would lead to this person isolating themselves even further when they are mentally ill. Now, an alternative to this openness would be for one to do what we call selective disclosure, where there is a group of people with whom you share your private information or disclose your private information, and a certain group that you actually keep your condition a secret to. Continuing with the disclosure, I want to say that coming out is not a black or white kind of decision. There are strategies that you need to implement so that you can reduce the risk of disclosure. And I'll summarize that in the next slide. There may be benefits with selective disclosure, which I said is an alternative, such as an increase in supportive peers, where there's still a secret, but there are people who are there to support you, who don't feel that this is a shame to be mentally ill. However, there are people who choose to be indiscriminate about their disclosure, who completely abandon the secrecy of their mental illness or mental condition. They make no active effort to conceal their mental history or their experiences. They literally broadcast their experiences, which means that they educate people about mental illness, and they seek out people to share their own past history and current experiences with mental illnesses. And in so doing, they get the additional benefit of being able to foster their own sense of power over the experience of mental illness and stigma. The third manner of challenging stigma would be using peer support. Nowadays, we do have consumer-operated programs which offer a way of for people with serious mental illnesses to enhance their sense of empowerment. And these groups will provide a range of services which include support for people who have just come out with their condition. They offer recreation and shared experiences which foster a sense of community within a larger hostile culture. And then they also advocate and politicize the efforts so that they can further promote group pride. Some of these consumer-operated programs reflect dissatisfaction with mental services that disempower people by actually putting them in restrictive settings, you know, and they represent a natural tendency of persons to seek support from others with similar problems. And then recently, we have a variety of consumer operative service programs that have developed, which include drop-in centers, housing programs, your homeless services, your case management services, crisis response, benefit acquisition, anti-stigma services, advocacy services or groups, and employment programs and so forth. So participants who are in these programs show improvement in self-reliance, and they are kind of more independent and have better coping skills and knowledge, which boosts now their feelings of empowerment, sorry. Now, how do you define mental illness stigma? There are 5 steps that you can follow which will assist you in defining mental illness stigma. The first one being to stop labeling yourself. The most powerful words you hear are the ones that you say to yourself. So if you stop labeling yourself, you are doing yourself a favor. For instance, rather than saying I am bipolar or I have bipolar, it would do you a whole lot of good to actually say I have been diagnosed with bipolar. Because now you're telling yourself that you are not the condition. You are actually somebody who has got a condition. It is more of a mouthful, yes, but you are communicating something here. And words are very important. We can create our world by changing the way we speak, especially concerning ourselves. You are not in denial when you start putting it that manner of saying, I have been diagnosed with bipolar, but you are saying something more positive towards yourself or about yourself, which will resonate on the outside, and people will soon know what your stand is around the mental illness that you have. Secondly, you must know that you are valuable as a person. When you can say something positive about yourself, you will soon begin to discover your self-worth, and you will know that you are valuable to the world. So we've got a lot of famous people like your Van Goghs, your Isaac Newtons, your Charles Dickens, to name a few, who have suffered from mental illness, but today, where are they in the annals of world history? You know, so it's a matter of they understood their value, and they decided that they're not going to die a miserable death because they are understood to be mentally ill. Thirdly, you need to surround yourself with the right network. And then if you associate yourself with people or watch movies that portray mental illness in a stereotypical or stigmatized way, you soon start thinking that or feeling the same way about yourself. But if you hang out with people who boost your morale and confidence, then you get to be, of course, confident and out there. Fourthly, it's important to have a mentor or a coach. This is someone who truly believes in you and your more glorious future. You know, you'll find that many people may tell you to lower your expectations. Funny enough, even health professionals may surprise you with statements like, you know, this dream is bigger than you, you know. So it's important to always find someone who can see behind or beyond your sickness, one who shares your dreams and aspirations. It works wonders for you as a mentally ill person. And the last one, but not least, of course, is that you need to take treatment. Taking treatment is not a sign of weakness, but isolation or avoidance of treatment, it will not cure your mental illness. It only makes your thoughts wilder, and it ultimately affects your self-esteem even more. And if you're not getting medical treatment, my advice would be that take the step now and today. So in essence, I'm saying to you, for you to cope with self-stigma, what is important is that get treatment. Don't let stigma create self-doubt and shame. Stigma doesn't come from others. It comes from you. Don't isolate yourself. Don't equate yourself with your illness. Join a support group. Get help at school or in the workplace or from important others and experts, and speak out against stigma. And then you need to cultivate some very simple mechanisms that will help you to cope with stigma. Simple things that you can skill yourself in or associate with, like elucidating self-acceptance, being affectionate and getting hugs from people, using food that you love, like hot chocolates, ice cream, and fruits, things that will make you happy, you know, like doing cooking, doing baking. These are any other thing that is value creating as an activity. Take a walk, have an exercise, go out in the sunshine, get a pet to cuddle with, and so forth. That helps a lot. But in summary, I will say that stigma is a societal creation which psychologists have come to describe as prejudice and discrimination, basically. And unfortunately, some people with serious mental illness internalize stigma and suffer from significant blows to self-esteem and self-efficiency or efficacy. Self-stigma, however, is not an inevitable case. It's something that we can work on. People in a stigmatized group do not necessarily turn that stigma onto themselves. And internalizing prejudice and discrimination is not a necessary consequence of stigma. Many others are unaware or unmotivated by the phenomenon altogether. There are those who, however, seem to apply the prejudice to themselves and suffer less in self-esteem and self-efficacy, which is unfortunate. These people, well, might benefit from structured programs which will challenge their beliefs, and it will allow them to learn that these irrational statements that plague their self-identity are actually baseless. And as a take-home message, I want to appeal to you guys and say that we need to recognize stigma as unjust and inhuman. We need to take on a personal goal to change and influence others to change how they believe or think about mentally ill people. And finally, mental illness does not discriminate. I will allow questions. Thank you.
Thank you very much for your presentation, Mzi. The first question is actually again directed at Gustaaf. Gustaaf, I just see you still on the call. And the question is, how does an employer deal effectively with staff who disclose they are suffering from burnout? And is there a best practice available to deal with this?
Just say again, how does an employer deal with somebody? So obviously you've got to deal with it confidentially, like any disclosure. And once you've disclosed it to an employer, they are obliged to figure out how they can support you. And that support can either be through in-company resources or alternatively referring you to somebody like the SADC people, the the stress and anxiety or depression group. The other thing, Marilyn, while I'm on the thing, I was answering some of the questions, just typing answers, but there was a question which I think is very important, is people were asking about this brain fog and sort of forgetfulness and things like that. Something to just bear in mind, that is probably a symptom of long COVID. So about 1 out of every 5 people who's got COVID tend to have symptoms for quite long afterwards. And that what's described as brain fog, that inability to concentrate, not getting things done, could be part of long COVID. And if you think you've got that, you've got to go and see a medical person. Sorry, is there any other questions, Marilyn?
Gustaaf, there was another question that I think is worthwhile to address, and it was on whether it is possible to miss symptoms that are indicative of a mental health disorder.
The answer is yes, right? As a matter of fact, it is incredibly common in South Africa, is that, so let's just use something we all know, you know, the expression grumpy old men. In most cases, old people who become grumpy are actually depressed, and they don't get treated because we just assume it's that way. And in a lot of our communities, the same thing applies. I've heard so often people say, my family say to me, why would you be depressed? You've got a job, you've got a house, you've got a car. So the bottom line is, I think screening, and these screening tools we've got on the Masiviwe website, no, I got that wrong, Masiviwe website is really important. Go there, there's 23 screening tools. And if you screen and the tool thinks you've got a problem, it's going to say to you, contact a professional. And if it says to you, contact a professional, go and contact a professional. I'm in the same boat. I've always worked hard. I've always been able to cope with stress. And then about a year ago, I suddenly realized I am not coping. I am getting angry. I'm getting frustrated. And I did one of these screening things for depression. And I suddenly realized I have got mild and moderate depression. And I eventually ended up seeing a psychologist and then eventually a psychiatrist who put me on antidepressants. And it is the best thing I did. I cannot tell you what a difference. And these are medications with virtually no side effects, and they cost nothing, right? There's so many generic versions out there. It literally, it's like, and I've watched this with other family members, because what inevitably happens once you experience the benefit, you go and pull everybody else in, but it changes your life. So no, because we don't have got access to mental health care at community level, and because there's such a lot of stigma and self-stigma, as Mzee has just talked about, people have got used to it, and they're just living with depression, they're living with anxiety, and they just assume that's how life is, and life doesn't have to be like that.
Gustaaf, just another question for you is, can I use time off as a way to manage burnout?
Well, yes, absolutely. So taking time off is really important about it. But depending again in which job you are, right? So taking a break, taking a holiday, we know people didn't do that during the lockdowns, and everybody ended up with accumulated leave. So taking a good holiday, absolutely a great idea. But if your in-tray just keeps on piling up while you're away, the other thing I would suggest is just go and teach yourself basic time management skills. What we'll do as FPD is, there is a recording that I shared with the Secretariat, the one they started playing at the beginning, which is this talk, but in a video format. So we'll put that on a website and share the link with everybody. And we also have a basic time management little webinar, that recording that we've got, and we'll share that with everybody who registered for this webinar as well. So go and use those resources. They're online. It's just going to cost you a bit of bandwidth to access it. And the time management one is something I did. It was one of the best skills I learned about 30 years ago, is how dramatically you can change your whole work environment if you just apply time management skills. It's called the Pareto principle. Again, you can Google that. But in essence, what it says, we get 80% of our results in the day, we get from 20% of the time. And what time management teaches you is how to spend 40% of your day in that high effective format, which means your productivity jumps to 160%, takes away a lot of the stress and the burnout because, and that's what I found. I found previously where I worked from 6 in the morning till 6 at night, suddenly 2 o'clock in the afternoon, 3 o'clock in the afternoon, I was done. And I promise you, I do not work at night unless I'm doing a talk or something like that. I stop my working day at 5 o'clock and I can cope with it. But time management is an incredibly valuable skill and we'll give it to you free of charge.
Thank you very much, Gustaaf.
Monica, you've heard the promises I've made. Will you make sure that we load those 2 webinar talks and share the link to them with everybody on today's webinar?
I heard that, Gustaaf.
Okay, thanks, Monica.
Thank you, Gustaaf. So the next question, I'm going to take 2 last questions. Unfortunately, our time is up. So the next question is actually to Mzi. And the question is, does stereotypes cause stigma, or is there any relationship between stereotypes and stigma? Over to you, Mzi.
Well, I would say, ma'am, stigmatizing a person is a stereotype. It's kind of like a stereotype, stereotyping. Yes. So there's basically no difference, but then the effects of that are basically the same, and then the managing them is also in the same way. You manage them in the same way. Marilyn?
Thank you, Mzi. Then the last question that I'm going to take is specifically, and I think, Gustaaf, you can also answer on this one, is are there any facilities in Namibia for mental health screening?
So screening, I think you can do online, but there is in Windhoek, there is a private psychiatric hospital. And there is, I'm desperately trying to think, there's a whole network of, if you go and Google psychology, online psychology Namibia, you will probably find that there's a whole telemedicine solution in Namibia, because Namibia is, you know, big country, not many people. So telemedicine is a really valuable resource to link people to the small pool of psychologists they've got in the country. But there's definitely is a program there. That's a telemedicine one, and you should be, and if you can't find it by Googling it, email me. My email was on that last slide and it will be shared with you. And I'll connect you with the people in Namibia.